Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to prevent back pain surgery naturally. And I will go over the 3 natural steps that you can do at home to actually prevent or relieve your back pain symptoms. But before I do that, I will go over the symptoms that you might experience due to back pain. Also, I will go over the causes of back pain and the normal healing cycle of back pain so you can get to the root cause of the problem so you can treat it naturally. So before I start, I want to go over a few studies that reviewed the statistic rates of the success and the failure of back pain. And I have the link for the studies on the screen, and also I will have it down in the description part of the video. So this report indicated that half of the patients that had undergone more than one spinal surgery, actually half of the patient went through more than one back surgery, which means the first surgery failed, so they had to go through a second surgery due to the failure of the first surgery. So another study report indicated that increase the complexity of back surgery, increase the rate of FBSS. FBSS is failed back surgery syndrome. That is actually diagnosis because it's very common to have failed back surgery. That is diagnosed as a disease because it's very common to have a failed back surgery, so those patients are labeled as failed back surgery syndrome. So when they looked at the failure rate, they found it is around 30 to 46% of lumbar fusion. Another study confirmed it's a 30 to 46% failure of the lumbar fusion. Lumbar is a lower back part, and fusion surgery usually they have a rod that fuse or connect a couple of vertebrae together so they don't move. So what are the symptoms of back pain? That's depend on the injury location. So if your injury around lower part, you can see here that image for the nerve distribution from the back going down to the legs and from the back going to the front too. So it depends on the location of the injury or the lesion that would determine the symptoms you're going to experience and the radiculopathy or radiated pain that you will experience in different location in the lower extremities. So some of the symptoms you might experience: numbness, tingling. Some patients might experience weaknesses, of course, pain, and decreased range of motion. So it depends on severity of the injury and the location that will determine the severity of your symptoms. So what are the causes of back pain? It's very important to know the causes, and I don't want you to stuck in diagnosis. I have herniated disc, I have performance syndrome, because when I go over the healing cycle, all these diagnoses are indicative of location of the issue. It does not tell us what to treat. But when we understand the normal healing cycle, we will not care about the location. We will care about where your body is stuck in the healing cycle. And that's how we can get to the root cause of the problem. So you might be labeled as you have degenerative disc disease or herniated disc. And as you can see here, this is a top view for the vertebra. We have the disc here, the blue part here, and you have the spinal cord in the middle here, and you have your nerves coming down from the spinal cord, so it's applied your lower extremity with the nerve ending. You might have back pain because you had whiplash or accidents or trauma or falls. If you've been labeled like sciatica, usually it's affecting your nerve L4 and S3 nerve distribution, also poor posture, poor body mechanic. It's extremely very overlooked. That is causes for back pain. If you have osteoarthritis or rheumatoid arthritis, that could cause also back pain. So looking at this image, this is normal disc. As you see, everything is nice and smooth here. You have the disc here, and you have the outer layer of the disc is called annulus, and you have the nucleus inside here. When you have herniated disc, typically the outer layer, the annulus, is actually kind of cracked or broken, and the nucleus start to push on the nerve. So reality is majority of us have herniated disc. And there is a study shows that most of the people have herniated disc, especially when you are 40, 50 years and older. That doesn't mean your symptoms actually from herniated disc, because they found patient that have herniated disc has zero symptoms, and other patient have very minor herniated disc and they have symptoms. So herniated disc is not indicative of the accurate location of your problem. And I will tell you why when we go over the normal healing cycle. So this is a side view of the vertebra. You can see the herniated disc is pushing on the nerve. So as you can see, this is the front of your spine, the back here in the back. And the yellow part, those are the nerve ending that coming out. Your pelvis is here, and this is a kind of visualization of herniated disc. And you see that red part, that's when the disc between the vertebrae start to sticking out and compress on the nerve that coming out from the spinal cord. If they labeled you as a patient that has degenerative disc disease, that is typically when you look at the side view of the vertebra, everything nice and smooth here. Degenerative disc disease, you will start to have arthritic changes, which is the edges of your vertebra start to kind of like be uneven, like here, and that compress on the disc and could push the disc more to cause herniated disc. Or your problem could be from pain from the arthritic changes in the vertebra, because you might have bone spur or excessive inflammation that actually cause muscle spasm in the back. So how to get to the root cause of the problem, and what are the 3 natural steps that you can take at home to treat your back pain? Before I do that, I'm gonna go over the normal healing cycle so it will make sense how we can treat it effectively. And also I will go over a few of the current treatment that's not effective based on research. Normal healing cycle. So I'm gonna use external paper cut for visualization, but the process happened internally from degenerative disc disease, herniated disc, sciatica, arthritis. So any label that they labeled you with, like performance syndrome, your body has to go through those 3 stages in order to heal. But we don't see it because the skin cover it. So when you look at the first image here, the first stage of healing is called inflammation. So when you have a paper cut, you start to have swelling, redness, the blood start to rush to that area, and you can see it here in the first image. And by definition, when you look at any of those labeled diagnoses, herniated disc, that's going to be inflammation that will be tear here that cause swelling and compression on the nerve here. And the second stage of healing is called the proliferation stage. And during this stage, actually, your body starts to build the scar tissue, and you can see it here in this image. During this stage, there is a cascade of events: scar tissue, fascia restrictions, muscle spasm, and trigger point. So for the sake of the time, I will just focus on the scar tissue now, and we'll go over in depth what the 3 steps we have to take to really address this healing cycle. So if your body does not build a scar tissue, it's an open wound susceptible for infection. So scar tissue very essential for our survival. So when we look at those diagnoses, herniated disc or degenerative disc disease, all of these excessive fibrotic tissue that happen in the joint itself. So that's actually basically a scarring. Or if they label you, you have like bone spur, that's a fibrotic tissue in the bone, which is actually a scarring. So looking at the normal healing cycle, we know that is scarring is a big issue with all of these diagnoses. Performance syndrome, you probably have a tear in the muscle that compress on the sciatic nerve that um, going through the performance muscles and will cause pain and discomfort because it compress on the nerve that going down. So it doesn't matter what label you was labeled with. What matter is how bad is your inflammation and how bad is your scarring and fascia restriction in the proliferation stage, because those are the root cause of the problem of all the back pain issues. What are the treatment that currently used and based on the studies? And this is actually, I'm going to go over a summarized literature review that went over 16,000 articles and concluded that these treatment not effective to treat pain. So heat and ice, stem, foam roller, massage, joint mobilization, dry needling, stretching, strengthening exercise is not going to help with your pain. It actually could cause more inflammation. And when we go over the healing cycle for each of these elements, it does not make any sense. Any of these treatment actually could relieve pain. So ice and heat, when we look at the normal healing cycle, it's temporarily going to decrease your inflammation, but it's not going to break the scar tissue. It's not release your fascia restriction, actual massage, or it could cause more inflammation. Joint mobilization, it's actually moving the joint, and it's also called joint mobilization or manipulation or joint adjustment. And that's basically just moving the spine back and forth. And when we look in the healing cycle, that is actually too much mobility there. It could cause more inflammation, but it's not going to actually break the scar tissue or release your fascia restriction or be effective as part of the treatment. Stretching, it's not going to really, if you have a scar tissue or inflammation, actually some studies showed that stretching could cause more inflammation. Dry needle, and when we look at the study that shows that stretching and exercises, there's 8 systematic reviews at least, and those studies looks at 100 and 1,000 of studies shows are not effective for pain. Spine manipulation, 6 systematic reviews. Acupuncture, 5 study indicate that's not effective as a long-term pain reduction, and so on this list. So what should you do at home? So we need to really look at this healing cycle, and if we really focus on the healing cycle, there's 3 big elements that we have to address. First, inflammation, and especially if you have a chronic condition, your body going back and forth between inflammation and proliferation stage. So the inflammation, what should we do for inflammation? So from my personal experience, and that's what I do with my patient, is to rest first. But if you have chronic condition, rest will not be enough to really decrease inflammation. So what I do, I use the Magna Heal 2, and they actually can wear it at home, use it throughout the day. The Magna Heal 2, very strong magnet that has anti-inflammatory coating, and the range of the magnet is around 3 inches. So when patient wear it in the back, that is actually can go deep to the vertebrae, and actually if you have herniated disc or you have performance syndrome or arthritis, that the range of the magnet can be strong enough to really go deep enough to decrease inflammation. But think about this way, when we treat the body, we have to be comprehensive to really decrease the inflammation. So while I'm having the patient wearing the Magna Heal, I put them on anti-inflammatory diet, because there's certain food that cause internal inflammation in the body and slow down the healing cycle. And for severe conditions, for pain, if your pain level is from 0 out of 10, about 7 to higher, that's indicative of severe internal inflammation in the body, and we have to be aggressive naturally to decrease the inflammation. So I will include the link on the bottom, a list of supplements to work on decreasing the inflammation in the healing cycle, and also to repair the tissue, which include magnesium, collagen, and other vitamins and minerals that actually required for the body to move fast from the inflammation stage to the proliferation stage to maturation stage, which the stage that we want to be in, that's mean your body totally healed. Okay, so the first step is we have to be aggressive to decrease the inflammation. The second thing, when we look at the healing cycle, there is a scarring, and a lot of the time the body builds the excessive scar tissue that's in the way of normal tissue. As you see here in this image, that excessive scarring will cause compression on nerve arteries and could cause symptoms. So what should we do for the scarring? Okay, first, before we do anything, this is a good image to look at. So your muscle look like nice and smooth like this. So when you have a tear in the muscle or micro tear, it's gonna happen randomly here, like the second image here. When your body starts to build the scar tissue, it's gonna build it randomly. We need that scar tissue. That's a very important part of healing. The problem is we don't need excessive scar tissue, because when you start to palpate it, you will feel it's a knot, and that knot gonna compress on your vertebrae and your nerve and cause symptoms. So what I personally do is I use the A3 to break superficial scar tissue in the back and the performance area and whatever that there's a scarring. And then I use the A5. This is very good instrument to use to really go deep to the tissue to break it down. So we need to break that scar tissue. So the third step that you can do at home, and this is extremely overlooked by a lot of healthcare providers because there is not a lot of effective approach for it, and I will go over why this is extremely important. So the fascia system, and when we look back here, the fascia restriction, that's part of the proliferation stage. So the fascia system, the fascia is the white filament that you see here in those images. That's a cadaver when they do dissection. And when you go buy meat next time, look at the white filament there. That is the fascia. So the superficial fascia layer is like wrapping the entire body. So it's like a Spider-Man suit, very thin layer under the skin wrapping everything, and you see it here, that white filament. And we have layers wrapping each individual muscle and group of muscle and each individual fiber to the end of the endomycin, that each individual fiber that's happening. Why fascia system could be an issue? Because when you have fascia restriction, it's like you're wearing a t-shirt 2 to 3 sizes too small. So it's gonna compress on a nerve and artery and limit the range of motion. And some of you might experience like a feeling of band that is causing pressure on the tissue, and that's typical for fascia restriction. Or you're feeling a rope in your muscle or tissue and knots, and that's sometimes a fascia restriction with the scarring that cause those issues. So we have simultaneously work on inflammation, releasing the fascia restrictions, and also breaking the scar tissue. So for the fascia, what I personally do, I use the A1 to release superficial fascia and apparatic fascia, because there's different layers of fascia. And with the A5, I use it to work on release the deep fascia restrictions. And when we look back to the normal healing cycle, you will break it this way by decreasing the inflammation. That's the first step. And simultaneously, I have to utilize or implement those 3 steps, because you cannot pick and choose when you have back pain. Okay, I'm gonna work only on the inflammation and I will ignore the scar tissue. It's not gonna work. You will continuously have that vicious cycle. Or you're saying, okay, I'm gonna work only on the fascia restrictions and I will ignore the scar tissue and the inflammation. That's not gonna work. That's why those studies for those treatment indicating that are not effective for pain, to relieve pain, because they're not addressing the root cause of the problem, or they're not addressing the normal healing cycle to really get to the root cause of the problem. So I will leave the link for the instrument and how to use it at home. We'll see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.